This video's aim is to help if you are suffering with golfer's elbow. If you get pain when you grip, when you push down on your hand as follows, and get pain on this stretch, then you may have golfer's elbow. You should also note tenderness when you press down on this spot on your elbow. A secondary effect of golfer's elbow is stiffness and pain in the elbow joint. So you should stretch this out as follows. Flexion. With your elbow by your side and palm facing up, bend your elbow to bring your hand closer to your shoulder. Now use your opposite hand to push it for more of a stretch. Hold for 30 seconds and swap sides if needed. Extension. Rest your elbow on the edge of a table with a towel under your elbow. Straighten it out until it is fully straight. Now use your opposite hand to apply an extra stretch. Hold for 30 seconds and swap sides if needed. Pronation and supination. With your arms by your side and your elbows bent at 90 degrees, interlink your fingers in front of you with your thumbs on the top. Now twist your hands so that your thumbs are pointing to the right. Hold for 30 seconds and then twist until they are pointing to the left and hold for a further 30 seconds. Next, you need to stretch the forearm and tendon itself. With your elbow straight and your hand, palm facing up, bend your wrist so that your fingers point towards the floor. Use your opposite hand to apply extra stretch. Hold for 30 seconds and then swap sides if needed. You should do these exercises at least 3 times a day, or ideally little and often. You should try to avoid activities that irritate the area and increase your pain. Once you are settling down, then you need to strengthen the area gradually. Holding a light weight in your hand, with your forearm resting on a table and your palm facing up, slowly lower the dumbbell down towards the floor and then lift it back up towards the ceiling. The forearm shouldn't move at all throughout and it should be pain-free. Repeat 8 times and swap arms if needed. As you get stronger, you must advance the resistance level gradually, but you can only advance if it is pain-free to do so. If you get worsening symptoms or are unsure, then initially reduce the push into discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. After several days, you should hopefully notice increased flexibility and possibly reduce pain generally. Remember, injuries take time to recover and do so gradually, so be patient, there are no miracle cures.